In the past week, the DeSantis administration took another step forward with its proposal to eliminate Medicaid coverage for transgender treatments.
Both national and state LGBTQ plus advocacy groups have pledged to fight against the proposal. Investigator Lewis Bolden joins us now with reaction from the transgender community and a group that sees firsthand the impact that proposal could have.
Well, good morning, ladies. People we spoke to say it is a step backwards for the state. They believe Republicans are targeting trans people. Meantime, a local program that has changed the lives of more than 150 trans people in Central Florida is gearing up for its next class.
32-year-old Christopher Roberts wears many hats.
I am a writer, poet, salesman, father, and a gym junkie.
He says a friend introduced him to the Transformation Program through Bliss Cares, a nonprofit organization affiliated with the medical clinic Bliss Health.
When I first started, I was doing research basically online.
Bliss's Transformation Program is a 7 to 8 week course that helps transgender people navigate their transition, including how to address problems that may arise at work and how to legally change their name. Sin was Christopher's name before his transition.
If you don't have any background in legal documentations, the whole packet is just extremely confusing.
But as more trans Floridians find a resource in Bliss, other resources are being threatened. At Governor Ron DeSantis' urging, last week, Florida's Agency for Healthcare Administration published a notice for a proposed rule change for the general Medicaid policy. The rule declares gender dysphoria does not meet the definition of medical necessity, which means Medicaid would no longer cover transgender treatments, including puberty blockers, hormones, and sex reassignment surgeries.
That's pretty barbaric, I think.
Ace Davis is the program manager at Bliss Cares and runs the Transformation Program.
I just can think back on how impactful all of the trans-related services have been to me, from hormones all the way up to surgeries, and to not have access to those is pretty devastating.
Equality Florida, the state's largest organization dedicated to ending discrimination based on sexual orientation and gender identity, estimates the rule change could impact about 9,000 trans people insured with Medicaid if it's enacted.
It was like a black cloud the whole time.
That's how Chloe Hilton Weller described her life before she discovered Bliss Cares.
Bliss helped me with everything: medication, therapist.
Bliss Cares is a 340B organization, which is a federal program that allows them to pay a reduced cost for medications, including hormones for trans patients and HIV treatment and prevention. Many insured and uninsured patients are able to receive these medications at no cost through Bliss. The organization also helps people secure trans-inclusive health insurance.
So it's created a space for a lot of people to have access to surgery that they otherwise wouldn't have access to.
Oh my God, it's amazing. It's amazing, yeah.
It's amazing? Why is it amazing?
I just get to be my true self. It's so inspiring and so beautiful just to be yourself.
Well, Bliss started the Transformation Program in 2017. They meet once a week for about 3 hours, which includes dinner. The organization pays for name changes for everyone who completes the course, which can cost about $500 each. They plan to have the next class in mid-August. And I have to tell you that Chloe's soundbite was my favorite soundbite of that piece, where she said, it is just so beautiful just to be yourself. And that's what every trans person wants. That's what anyone wants, just to be the best version of yourself.
And what an amazing organization helping make that happen.
Yeah, they have so many resources that they share with the community. They put money back into the community. So there are a lot of resources out there for trans people that a lot of people don't even know about. So that's why we wanted to highlight this program.
And what is the next step for the Medicaid rule change?
It is moving along, and it is moving along pretty quickly. The Agency for Healthcare Administration has a hearing set for July 8th. We are going to include a link to the proposal with this story on clickorlando.com. It does have a place where you can submit comments online at the bottom of the page. So if people want to do that, they can do it right through that link.
I'm so glad that you also included that screenshot from Bliss's website about all the different things that they cover and help with, because it also includes just regular doctor's visits and things that, you know, trans people who are dealing with so much, the number of co-pays, the number of doctor's visits, a basic need.
You know, and certainly during Pride Month, I did not want to come out here and do a story about what's being taken away without highlighting a program that is offering a number of resources to the trans community, because people need to know about that as well.
All right, Louis, thank you.
No problem.